Hello, welcome to the final video in the Expert Skills Program Self-Study Block. This video will explain the most effective way for using practice questions to prepare for Step 1. It will also explain how to make group question analysis the perfect complement to your individual concept mapping. Before we begin, remember that filling out the study guide during the video helps you get the most out of what you're viewing. The primary goal of the ESP Step 1 Prep block is to improve your performance on all exams throughout the first 2 years, not just Step 1. This is achieved by limiting the attention for each study session to current material covered on the upcoming course exams. This ensures that time spent on group study automatically becomes course study. The dialogue is always centered on explaining reasons, thus requiring the use of the front of your brain. Since the study sessions are held weekly, you will have prepared yourself for Step 1 as an integral part of your normal coursework. A second goal is to develop the higher order thinking skills that determine success on Step 1 case vignette questions. This goal will actually extend into the clerkships after Step 1, since it represents exactly the type of thinking that attending physicians expect for you to develop in your clerkship team discussions. The ESP system teaches you to reframe your thinking process to build your ability to analyze the patient data presented. Also, as you will remember, there is a need for an emotional connection to what you're learning. Thus, the person-to-person dialogue provides an extra bonus of very durable long-term memory. These goals cannot be met if you just simply phone it in. The next slide describes a critical awareness that makes the process effective. First, I want to extend credit to the LSU School of Medicine for creating the QUAG acronym for our Step 1 program question analysis groups. It was just too catchy to pass up. Okay, if you're going to maximize the benefit of participating in a QUAG, you must share a special awareness with everyone. It involves thinking beyond the actual knowledge that is being discussed. It is very analogous to a sports team that succeeds because of the teamwork they demonstrate. Talent gets a team in the game, but teamwork is needed for them to win. This teamwork is made visible when there's a driving need to create a consensus in the discussion. The consensus sought is an agreement that the rationales for each question were complete. This will be explained more thoroughly below when we spell out the steps in the process, but the point for now is that you should feel like an attending physician is in the room and making a note of what you say. How do you want to be heard? If you don't already know, I can tell you that you just don't want only the right answers. You want the right answers with the right reasons. I can assure you the attending will ask if you don't give the reasons. This is produced only when a rationale is understood by everyone and not just accepted as something that sounds okay. Thus, your awareness guides what you say, and what you say guides what you think about. Awareness of thoughtful reasoning will be a guide of thoughtful discussion. A simple rule of thumb is to always be ready to explain why. This will generate an attitude of wanting to understand. You can tell when you're in an ESP QUAG because there is an atmosphere of activity. If people aren't saying something, they're looking up what needs to be said. People are not just sitting and waiting for someone else to speak or tell them what to do. People are listening to the thinking of others, and that thinking is aimed at the answer choices. Let's consider an answer choice that is wrong. As you will see in some of our examples, Some wrong answers could be considered as partially correct in that they require certain conditions that are not addressed in the question. It is because of this type of wrong answer on step 1 that students are fearful. That is why we confront that fear directly during the quags. When you understand why you're ruling out wrong answers for one case vignette, you understand why they are correct answers in another case vignette. The same reasoning applies to a correct answer. If you understand why it's correct, then you will be able to explain why it is incorrect in a different question. Explanations put you in charge of your learning. Now, before we show our example, let's look at the general procedure for reviewing a case vignette question. The setting is any room with a big whiteboard and one volunteer student leader to record the information into a special concept map. The group leader is there to document the discussion and has no obligation for special preparation to know more than the others. No preparation other than normal study is needed for any of the group members because the entire process is open book. The process of recording into the map will be illustrated in the example that follows. The process begins with the first student reading the lead-in and then the rest of the stem. The lead-in is the actual question asked at the end of the stem. This backward process helps to put the rest of the stem in context as it is read. This also reflects the process that should occur in your mind when you're taking step 1. The quag method is designed so that each student either offers a rationale or passes to the next student. No pressure is needed to make this process work. If the process stalls at first, just ask, what are the important trigger words in the stem, or why? Why are they trigger words? Finally, to help the group reach consensus, the leader can ask, is that all for the stem? And then you move on to the next step in the process. The next student reads out the first answer choice and provides a rationale for ruling it out or accepting it. If there is uncertainty about the rationale, then ask the question to the group, is this all we need to know to rule out or accept? At this point, it will become apparent that this is one of the first earmarks of the quag method that is unique. It is asking not how much do we know, how much do we need to know? The process proceeds until all answer choices are analyzed this way, leaving a map with facts connected to each answer choice. The map will be finalized by connecting answer choices with crosslinks to the relevant information in the stem. Now, we can illustrate this process by proceeding stepwise through an example. This case vignette question has a lead-in that asks about an alternative drug treatment since the preferred drug is not available. The question is framed to introduce a 54-year-old female who is brought to a clinic. It is worth teaching you at this point that all Step 1 questions are constructed to begin with the same type of information, namely age, gender, and place. Sometimes this information is very relevant, sometimes it's not relevant. The relevant patient data in this question are that she is in acute cardiac failure and a treatment is needed. The stem is followed by 5 alternative answer choices that will be discussed in depth one at a time. Now, in order to proceed with our example, it's necessary to talk first about a SidetoSide Concept Map template. This concept map template became part of the method to analyze case vignette problems because there were too many concepts to keep in mind and the conversation would wander. The SidetoSide map introduced a visual representation of the discussion where each concept and fact could be recorded and visualized as it was discussed. Keep in mind that all resources are available. It is open book, and this occurs throughout the discussion, and the goal is to agree on what information is the most important for each answer choice. Thinking about what is most important pushes your thinking to the front of your brain because it requires a decision, and that's where you want your thinking to occur. This is the descriptive version of the template that shows you what goes where. In the actual working version, there are blanks for the answer nodes, for the lead-in node, and the discipline category node that are filled in as you do each given question. This allows the same template to work for any case vignette. However, this template will not work for ordinary test questions, just case vignettes. The working template can be downloaded as a PDF from the ESP website at the resources link and printed out. And yes, I said printed out. In spite of the general practice of using electronics for note-taking, it's important to record the case analysis by hand during the session. If you want an electronic copy, it's very efficient to just scan your handwritten map. Now, let's proceed with the example. You will notice that this template is an earlier version compared to the one I just showed you, but I use it here because of the authenticity of this student's own notations, and because it's a simplified example as well. The first student has read the lead-in and the node is filled in. The first student continues with reading the stem and the group identifies the trigger words. The group decides which trigger words are entered. In this case, they recorded that the patient was in acute cardiac failure. They also agreed on listing dobutamine as the preferred drug and that it was not available. They probably didn't need to include that the patient was in a poor country, but this was an early group session, and with a little more experience, they would probably have left that bit of information out. Again, there's really no right or wrong here. The goal is to help facilitate a discussion. Okay, although this question does not include data that connect to the physical exam and the lab nodes in this diagram, you will find that in any case vignette question, these fields will appear, this kind of data, so these nodes will all be used. Although it is tempting to start discussing answer choices at this point, there's one more duty to perform with the patient data. Additional relevant information that aids thinking about the patient data is also added to the map by consensus agreement. You can see here that the students agreed that dobutamine should be identified as a beta agonist. Remember, they've only had this in lecture over the past week, so they haven't mastered this information and they needed the reminder. You can see a personal note that the student made for herself. Her note included in a cloud shape reminds her to go back after the session and review the concept of acute cardiac failure in more depth. This notation was the result of hearing the discussion and realizing she had not remembered enough about cardiac failure. So now we're ready for the next step that will consume most of the discussion time, the answer choices. With the lead-in and the answer choices entered into the template, the leader at the whiteboard logs in the answer choices into the nodes. This inserts a brief quiet period during the session, but don't let that bother you. Many students are still reflecting on the discussion of the trigger words, and some will even be starting their search for information on some of the answer choices for the upcoming discussion. So you can see in this example that the correct answer is designated. Most groups eventually adopt this practice to avoid wasting time trying to guess the answer. But it's not a problem to only reveal it at the end if your group prefers. The map's now ready for the group to think about the answer choices. The dialogue begins as described previously in the overview. The next student takes the first answer choice and proposes what information is needed to rule out the answer if it is incorrect. In this example, it is an incorrect answer, so the student has proposed that dopamine at a high dose acts both as an alpha agonist and a beta agonist. What you don't see on the slide is the rest of the conversation. You're only seeing the consensus that the group agreed was necessary to rule out the answer choice. No two groups will debate this the same, nor will they record exactly the same facts that they agree are needed. But now to make a major point about the strength of this group. Each individual involved in the process has discussed dopamine in a way that if it shows up in another case vignette question, either as a correct answer or a wrong answer, it will be much easier to determine. This is because group members will naturally propose changes in the question stem that would make dopamine correct. Each of these alternative stems is discussed as part of coming to consensus. Also, consider that while this question is about choosing an alternative beta agonist, the first answer choice already discusses an alpha agonist. This is far superior to reading and memorizing about the alpha agonist. The comparison with the beta agonist creates a memory that is networked and integrated knowledge. This is the easiest memory to recall, not just on a test, but in the clinic as well. So to summarize for just this first answer choice, the conversation has prepared you for more than just recognizing a correct answer in a very limited context, but instead of being able to think about it in any context. This procedure proceeds in the same way for each of the answer choices, including the correct answer. If you'll reflect for a moment, the review of one case vignette question prepares you for many. If you only consider one new question that is relevant to each answer choice, then one question will prepare you for 5, which means that reviewing 6 questions prepares you for 30. And if you attend one group session per week, in 15 weeks you've prepared for 450, and multiplying this times 4 semesters, you've prepared for 1,350 questions, all because you considered wrong answers as possible right answers for other questions. Furthermore, your preparation would have been spread across all disciplines starting in the very first part of the first year and covered in a way that is progressively integrated as you learn the material in your courses. It is worth emphasizing that post-Step 1, students report to me that they remembered many group debates as they took their course exams as well as on Step 1, and they especially remembered the arguments. Your recent video on how we consolidate memory during sleep explained that much of the long-term effect was due to emotion. When people are involved, emotion is involved. Now, even with what we have accomplished at this stage, we're still not finished. There's one more valuable step to complete: finding the crosslinks. In this example, the only crosslinks are from the correct answer choice. However, you will see in the examples that follow, crosslinks can also connect from partially correct answers. This is the first visualization of the torment of the student answering a case vignette question. It is a torment because partially correct answers have a correctness to them, and they're very tempting to guess at. The problem is they're just not completely correct answers. At this point is an opportunity to bring up a test-taking tip. Many students who are intuitive types especially have a talent for making an argument where more than one correct answer could be correct under certain conditions. This results in indecision and uneducated guessing, and as you can imagine, some missed questions. The answer choices that require conditions are the partially correct answers. The solution to this is to find the answer choice that has no conditions. Now, returning to our example, you can see that the crosslinks extend from the beta agonist nodes and from the increased contractility node to the acute cardiac failure node. Thus, this method provides a visual connection from the answer choices to the trigger words in the stem. And note the connection between increased contractility, which was mentioned nowhere in the question. It was brought out by the students in connecting the function of beta-1 agonists to what is needed to treat acute cardiac failure. In other words, there was an extension of reasoning that would never have been thought about by just sitting and looking over questions. Okay, once the crosslinks are drawn, this constitutes closure on this question, and attention can turn to the next question. At this point, it should be easy to understand why a single case question can consume 15 to 20 minutes at first. Your group will not likely cover more than 6 good case questions in one 90-minute session. But remember the multiplier. Every question prepares you for many. As a word of encouragement, groups do become more cohesive and efficient, and it's not unreasonable that after a few months, you will be using only 10 minutes per question. But be warned, the goal is not speed. This goal is depth. A look at several more examples allows us to see some important variations not shown in our simpler example that just seen. In this map that resulted from the analysis of a case vignette on bacterial virulence factors, there are several more links than we have just seen before. From the correct answer alone, there are 4 links. In addition, there are other links from several incorrect answers, the partially correct answer choices. In this case discussion, the students added some extra information to the trigger words from the stem to clarify the basis for flushing. They attached vasodilation, pyogenic cytokines, and even the names of several cytokines, just to be more specific. Just to emphasize, this is not the only way to discuss or to diagram. The students may or may not have discussed vasodilation in the answer choices. They just anticipated it might be worth their all being on the same page about what these symptoms mean or what was data collected in the history. In this discussion, just like those you'll have in the clinic, it will vary with the members of the group, and more or less information might be agreed upon. So, with this variation, what remains most important is the aspect that all students are motivated to look deeply into every concept addressed in this question, whether from the stem or the answer choices. This is just simply a process you would not take simply going through and quickly reviewing this material. It's the discussion that makes you look deeply. One final comment on the incorrect answers. When links occur in the discussion from incorrect answer choices, it also indicates the need to prioritize your answers as most likely because and least likely because. And this exactly mirrors what you will do in the clinic. Okay, the next example for anemias shows a similar type of discussion. The anemias covered in this case vignette don't represent all of the anemias that you will learn in medical school, but they cover 5 of them. One more vignette like this one, and you'll likely have reviewed everything you need to know about anemia. As before, you will see several recurring events. First, look at the left side at the patient data, and you will see additional information that the students discussed and extended and added to what was provided in the question stem. Next, on the right, you can view the extensive discussion that resulted in the posting of facts and concepts in the notes. What you don't see here, again, is the discussion and the arguments. And keep in mind, by the way, regarding arguments, these are the good kind of arguments, the kind that produce long-term memory. And no group in the past 15 years that I have mentored this process has ever had an issue with personal conflicts as a result of these arguments. You'll have these same kind of debates in the clinic. The third major observation is the finding of crosslinks from incorrect answer choices with the resulting discussion of prioritizing answer choices. The correct answer usually seems to be supported by the most crosslinks. They're said in another way, the weight of the evidence. This additional example supports the observation that the correct answer always has the greatest number of crosslinks. Before we look at how question analysis for non-case vignette questions differs from these examples, let's consider some other types of lead-ins that you might find and some general advantages to the expert skills method. The advantage of being familiar with lead-in questions is you can organize your individual study around them, especially in pathology. For example, in your personal concept maps, you can add additional nodes for likely lead-ins. The node would contain, literally, likely lead-ins. And you can connect to that node different types of lead-ins and the information that would be relevant to them. There are several lead-ins that are listed in this slide. The remainder of the common lead-ins can be found in the NBME website item writer's manual listed, and this website is listed in the slide. What you do is go to the website and click on Publications, and then scroll down the page to the Item Writing Manual link. And if you just scan through that, I think if you look in the table of contents, you can find the templates. As you can see from these different lead-ins, questions can be aimed at different disciplines. In fact, there's a specialized kind of question on step 1 called a case cluster. This group of questions uses the same stem in each question, but it's followed with a different lead-in at the end of the stem that are matched to different answer sets. So the same case can ask about anatomy or pathology and so on. So look for an example of a case cluster in the NBME writing manual for more examples. On the next slide, the advantages of QUAGs are pointed out. The major advantage of question analysis is in building the skill of anticipation. In particular, sensing type students often study concepts, but still lack a sense of how they will be tested. Analysis of questions on a regular basis reveals how incorrect answers are not tricky, but instead are related to the correct answer. Question analysis also shows how you have to think. Most of the higher order thinking questions require 2- or 3-step thinking, and many memorizers have remarked that their reading improves when they begin reviewing questions. The effectiveness of individual concept maps can be tested with question analysis by assessing whether they contain the necessary information to support discussion of an answer choice. That way you can go back and update your concept map to be sure it completely addresses the concept in a particular answer choice. And a final advantage is reported back from students after their comprehensive review that just precedes step one. Since this step one review is memorization oriented, it occurs just before the exam, and students remark how smoothly this particular type of review goes because they start with their maps from the sessions and then fill them in with the material, further material to be memorized as they went. It's important to see again, to emphasize, we've been discussing a preparation method that affects thinking more than memorization, although it produces it. The comprehensive memorization that is needed for every exam should occur in the weeks just before the exam. That all year long will waste your time. If you review this way, the memory that is built is solid, long-term memory. The memory that you build in the comprehensive review, I'm afraid you're going to find it'll work on step one, but it'll be fleeting after you finish the exam. Okay, a special problem exists now in year one. Due to the introductory nature of the courses, there's just not enough material to integrate. But the process will still work with regular questions, and I'll discuss this on the next slide. Although non-case questions can't be mapped, they're very amenable to a similar type of discussion, and simplified concept maps could be used in arguing a rationale. So you'd put up like what you'd call a mini map or a micro map just to make your point in your rationale. No template is needed here, and notes can be taken electronically or individually. It's still essential to reach group consensus, since this is what forces the thinking to a high level. The process still begins with the first student reading the stem. Since the structure of non-case questions can vary somewhat, there may or may not be a lengthy stem. In that case, just proceed to the first answer choice. Similar to the procedure for case vignettes, the student provides a rationale for the answer choice as an incorrect or incorrect answer. This is followed again by a group consensus about the information needed to eliminate or accept the question, and then the next student takes the next answer choice. As a reminder, the atmosphere of the session needs to be supportive. So if a student's not able this particular week to attempt a rationale, they can just pass. I have never seen a student take advantage on a consistent basis of attending and not participating. A little forgiveness goes a long way here. Now, for an example of a non-case question, let's look at the next slide. In this example, there are two trigger words in the question: middle cranial fossa and foramen rotundum. Before the answer choices are even discussed, both of these can be defined or described so that everyone has a consistent starting point to discuss the answer choices. An overview of each answer choice indicates that this question is asking about the loss of function in nerves that pass through the foramen rotundum. The correct answer is D, a straightforward loss of function in the sensory nerve to the maxillary sinus. However, the closest wrong answer is C, that also refers to a nerve in the same area. That's the partial correctness. The group discussion should include the rationale that the sympathetic innervation only joins the sensory nerve distal to the foramen rotundum and therefore does not pass through it. That means it would not be affected at all by a tumor. Check out Chapter 8 in the Success Types book for a more detailed discussion of this question. This single question covers numerous anatomical structures and their relationship to one another. A thorough discussion of this question would therefore provide active learning coverage of this topic. You can expect that the discussion of non-case questions will be faster. Now, before we draw this video to a close, there are two more relevant topics that will help your group perform at its best. The first issue concerning group dialogue is that everyone contributes valuable ways of thinking due to their personality type. If you're going to use deliberate practice to improve your thinking, then you need to understand the role that each preference plays. As you see here, opposites complement each other to build and bring strength to the group. Extroverts, for example, will energize the group, and by hearing the introverts, they can learn to think more deeply. When the sensing types hear big picture thinking from the intuitives, they learn to use it more quickly, and the sensing types keep the intuitives more honest when they remind them of details they overlooked. All of these effects from hearing each other during the session carry over into individual study. So the sensing types begin to read differently because they heard intuitive types speaking differently. Sensing types have commented over and over about how effective this is in changing the way they read. The feeling types haven't been mentioned very much up to now, but some feeling types can have a loss of efficiency due to how unpleasant it is to study with pure objective logic. So in the group, their comfort zone is harmony and helping others. Thus, the group satisfies their need for people, and at the same time, it helps them develop their logical deduction abilities, again, by hearing it. The thinking types develop their people skills by observing how feeling types handle the human interactions. The perceptive types in the group acquire some balance in their tendency to slow things down by adding just one more fact, and they also have a desire to make a contribution to the group, giving them a deadline in their individual study to get things going. The judging types save the day by keeping the group on schedule. Now, this can be overdone, but it's critical that groups don't wander too much, or running overtime will really lower morale. The final step to help close out this video is to provide a few training tips for those of you that want to start your groups and keep them going. If you develop an interest in organizing a group, then there are certain things you need to be aware of in order to help you succeed. First, your role is to never lead a discussion, but rather provoke it with a proper question. This is needed more as the group begins work and is needed much less after the group becomes cohesive. You will be able to tell from experience when to interject a question to move the conversation along. It's good to try and get the largest group size you can, because your goal is to hear different types of thinking, and different students will be prepared a little differently from their own individual study. However, you can work fairly well at groups down to as few as 5, and I've had one case where even a group of 4 worked out pretty well, but it was a very unique situation. So try and hit the largest number up to about 12. Another factor that you will gain from experience is that a group needs space to think, and that can involve briefly spinning their wheels. So a little thinking time can't hurt. Don't worry. After about 3 sessions, the whole group will develop a cohesion that eliminates this as a real problem. They just develop a sense of what's enough and when to move on. You can have some canned comments handy, like on an index card or in some other fashion, for stimulating the conversation. For example, you could say, is there anything else to add to the patient data notes? Or does everyone agree on the information needed for this answer choice? Are there any arguments or clarification for this answer choice? And one of the most valuable questions of all, what would you change to make this answer choice correct. This covers the ESP Step 1 prep method, so let's review our main points. Consensus seeking causes students to work together to fill in gaps and correct misunderstandings. Consensus is impossible without explanations that produce higher order thinking and thus long-term memory. Explanations also create a more interesting atmosphere that gives a feeling of satisfaction to the group members. It compares with how you feel after a workout at the gym. Once the protocol has been followed, it becomes second nature, and the only limit is the questions that you bring to the session. This video ends the pre-matriculation activities in Block 1 of the Expert Skills program. Thank you for your attention.